The Normal Newborn Nursing Care, Chapter 22. Early care for the newborn is done in the immediate time after delivery. This can be anywhere from a couple minutes after delivery up to 2 hours after delivery. If the newborn is stable, many parents want that immediate time for bonding and feeding. As nurses, you will be able to assess what mom holds or feeds. Many times we can get all of our early care done with the infant while mom is delivering the placenta and any repair of lacerations or episiotomies is being done. Most infants will receive an IM injection of vitamin K within the first hour of life. Remember, the intestines are sterile at birth and the normal bacterial flora is needed for the infant to synthesize vitamin K that the body produces, so we will provide that vitamin K injection for them. The parents have the right to refuse the injection, but we must provide education on the importance of receiving and the action of the medication. It is given in the vastus lateralis muscle. We will also provide eye treatment in the form of the erythromycin ointment to prevent against bacteria from gonorrhea. This is given even if mom does not have it. Without this medication, the infant can go blind from the infection. Once again, the parents can refuse, but we must educate. A thin ribbon of the medication is given in the conjunctival sac by going from the inner to the outer canthus and being careful not to touch the tip of the eye. It is given bilaterally. A bulb syringe is used to help clear the oral and nasal cavities from mucus. There is a procedure box in your book on the correct technique, so please review that. Remember to always depress the bulb before you put it in the mouth or nasal cavity. Also, if you need to suction both areas, you always suction the mouth first. I'm including immunizations in this section also because many facilities will get consent from the parents for the Hep B vaccine for the newborns and do it at the same time as doing the vitamin K and the erythromycin. This injection does require parental consent, so be sure it's obtained. It's also given in the vastus lateralis and the opposite leg as the vitamin K. Caring for moms and babies is an ongoing process. We will do a ton of education and assessing of our teaching to ensure the parents are prepared to take their infant home. Skin care includes assessing the skin for any changes and assessing skin turgor. Most infants are given a bath shortly after delivery. There's a video under the lab tab that you are required to watch before the first lab. Giving the newborn a bath is something you may be doing, so it's something you need to be familiar with. You must assure temp is stable before bathing and that temp is stable after bathing. The initial bath can be done under the radiant warmer to keep the infant warm. The infant loses heat from the head, so washing the hair last is recommended. Be sure to remove any wet linens from under the infant when the baby bath is complete. Care of the umbilical cord involves cleaning it with water once a day until the cord falls off. Tub baths should be avoided until that happens, and only sponge baths should be done. Assess the cord for any signs of infection. It's crucial we teach parents on the correct position for the infant is on their back. Studies have shown to reduce the incidence of sudden infant death syndrome that all infants should be placed on their backs to sleep. The infants also need to sleep on a firm mattress and no blankets, pillows, sheets, or toys in the crib. Education needs to be provided on not co-sleeping. This includes in the bed or on the couch or recliner. Suffocation can occur to the infant. Instead, the recommendation is that the infant sleeps in the parent's room in their own crib, bassinet, or etc. Protecting the infant includes ensuring infants always go to the right parents, prevention of abduction, and recognizing early signs of infection. All newborns will have 2 ID bands on that match moms and 1 support person, so anytime the infant is returned to the parent, the nurse must verify bands so the correct infant is with the correct parents. Circumcision is a choice parents need to make. There's quite a bit of literature for supporting it and literature for not supporting. A few reasons people will do or not are for cultural or health reasons. The provider would explain the procedure to the parents, and we are there to answer questions, educate as needed, and support their decision. Some providers will use pain relief prior to the circumcision, and other providers do not. The most common pain relief medication is lidocaine injection and is used as a local anesthetic by the provider. Embla cream is a local anesthetic cream that is applied to the area, but it's less effective than lidocaine, and it takes longer time for it to reach optimal pain relief, and many times it's not applied soon enough to get the maximum effects. A non-pharmacological measure is the use of oral sucrose. This comes in little tubes or containers that can either be placed directly in the infant's mouth, or a pacifier or gloved finger can be dipped into the substance. The oral sucrose helps block the pain receptors during painful situations and can be used in other situations besides just circumcision. Hopefully most of you will be able to see at least one circumcision being performed during your clinical rotation. The nurse's role during the procedure is to be by the infant and assist the provider as needed. This usually is helping the infant stay calm, opening any packages the provider may need, and support for the infant. Care afterwards includes monitoring for bleeding or other complications, educating parents on care, and answering questions. There are two basic ways to do a circumcision, and the care afterwards depends on the type. Most common way is the Gomco method, so I will discuss the care of that. Gauze with a large amount of petroleum jelly is applied to the end of the penis. This gauze with Vaseline is applied after each diaper change for the first 24 hours or longer depending on provider's preference. The Vaseline helps so the gauze doesn't stick to the end of the penis and pull off the formed blood clot. We teach parents to monitor for bleeding. A small amount of bleeding is expected. Typically, if it's more than a 50-cent piece, we want to know. If there's excessive bleeding, we need to put direct pressure on it and notify the provider. The bleeding should be less as time goes on, and after the first hour or so, the drainage tends to be more of a serosanguinous drainage, and this is normal. A yellow crust will form over the end of the penis as it's healing. This is normal, and we need to educate parents on this and the importance of not removing that. There are some screenings that all newborns will have completed before discharge. One of the first they will have is a hearing screening test. This is typically performed anytime after birth, about 6 hours of life. Waiting at least 6 hours helps the absorption of any fluid in the ears, which could hinder the results. There is a machine that contains electrodes and ear coverings. The length of time it takes to complete the test depends on how still the infant is and how quiet the environment is. If the newborn does not pass the hearing test, it will be repeated before discharge. If at that point the newborn still does not pass, a referral is made to the audiology clinic for further testing. Our job is to educate on the hearing screening process and answer any questions. Just because a newborn fails the test twice does not mean they have a hearing loss. It just means they need further evaluation. All newborns will have a newborn screening at 24 hours of life. In Michigan, over 50 tests are performed with this one screening. This can include any metabolic disorders that is not diagnosed and can be fatal. The test is obtained by filling 6 spots of blood from the infant's heel and applied to a special card. This card is then sent out and tested for disorders. Results will not be back before discharge, so the results will be sent to the provider. CHD is a congenital heart disease screening. This helps detect any underlying heart conditions that could be present. This is done at 24 hours of life as well. A pulse oximeter is obtained from the infant on the right hand or wrist, which measures preductal, and then obtained one from one of the feet, which is postductal. You want the pulse ox to be above 95% at each extremity and no more than a 3% difference between the two extremities. The results are positive or good if they meet that criteria. If the pulse ox is below 95% or more than a 3% difference is noted between the extremities, the provider is noted for further testing. We talked about the bilirubin testing earlier. Typically this is done at 24 hours of age, as it could be done earlier if the newborn was showing signs of jaundice. How long a mom and baby stays in the hospital after delivery can vary on some factors. Insurance has to pay 48 hours for a vaginal delivery and 96 hours after a C-section, but many go home 24 hours after vag delivery and 48 after a C-section. There's certain criteria that has to be met. Of course, both mom and baby need to be stable. No abnormalities noted. They want to be sure the newborn is eating and having good output. They want to be sure the parents are able to care for the infant and appropriate bonding is noted. All the necessary screenings need to be completed prior to discharge, and all the required education needs to be completed as well. If there are any referrals for medical care or community needs, then those need to be addressed as well. Follow-up care is determined by the provider. Most pediatricians want to see the newborn within 2 to 3 days after discharge, and the time moms will be instructed depends on if it's a vaginal delivery or a C-section. All of this is ordered by the providers and then given to the family in discharge instructions. Sometimes home visits may be ordered if there are concerns for mom or baby. The services provided vary per county. Some counties have funds for public health nurses or lactation consultants to do frequent home visits, but other counties may not provide these services. Families are instructed they can call the OB unit with questions or concerns, and if they are not able to answer the questions, they will be instructed to notify their provider.